It's American Health Month. A York County heart failure patient shared his story with our Mallory Metzner, hoping to help others before it's too late.
WellSpan's heart failure program has grown over the years, including both how patients can evaluate their own symptoms and how doctors can come up with treatment options.
It seemed like a normal day for me, but it wasn't a normal day.
It was almost 15 years ago when John Stover found out that something was wrong with his heart.
I went to my family doctor because I filled up with fluid.
After an EKG, the doctor offered to call an ambulance, but Stover drove himself to the hospital. Ultimately, he needed a defibrillator and pacemaker.
I prefer if I had a defibrillator and pacemaker in me because I'm an active person now.
7 years ago, he battled cancer on the side of his face and needed an operation. Because of his heart's history, he had a nuclear stress test first.
They found out, that my heart actually did get a lot stronger.
Stover started eating healthy, lost 100 pounds, and came out of retirement. At 75 years old, he says he feels like he's 40.
Every one of the doctors from WellSpan Cardiology has been absolutely phenomenal from day one. They saved my life, really.
Now, WellSpan also saves patients unnecessary trips to the ER.
We developed a protocol that our nurse triage call center uses.
Nurses evaluate symptoms like shortness of breath, swelling, and fluid retention. Some patients get immediate access to care while staying home.
An example, might be somebody who has chronic heart failure, who is starting to retain fluid, so maybe they have some weight gain, they're starting to feel more short of breath. They may be on medications at baseline, and it may be a matter of making just further adjustments to those medications, increasing the doses of a diuretic.
Patients also now have a heart failure zone tool to show them when it's time to call the doctor or 911.
Compared to 10 years ago, we may have 3 times as many medications, new devices and technologies that can be used to help take care of this condition and really make it something that can be managed and give patients an outlook for a good quality of life, a good length of life.
Stover achieved that good quality of life by listening to his doctors.
Tons of credit to my wife.
Stover tells me he now walks 5 miles a day. It's an example of someone who can monitor their symptoms and ultimately lead a healthier life. In York County, I'm Mallory Metzner, ABC 27 News.
Hi, I'm Eric Finkenbinder from ABC 27. We're excited to announce the new ABC 27 News Plus app. Live stream newscasts or watch content on demand. This is different than the ABC 27 app on your smartphone. You can check this out at home and it's very easy to use. With a Fire Stick, go to the home page, scroll down to search. From there, enter ABC 27. Move over to the apps and there we are. Click the icon and install. It's just that easy.